Anxiety, stress, fear. What are all the difference between them? And what is anxiety disorder? Myself, Sukumar. I am the student of occupational therapy. What is fear? Fear is an unpleasant emotion, so in which the person feels something or someone is going to be give pain to us or give threaten to us. That like the person feels. So someone is going to be give the pain to me. So that is the fear. What is stress? It is a natural danger. So our body recognizes the natural danger, which means a lion is come in front of us. Then our body produces more cortisol. It makes the stress and we may go into fight or flight action. We may run away or doing fight with the lion. So this is a stress. Fear is a belief of danger and stress is a natural danger. Our body going to fight or flight action. Then what is anxiety is also a if the person feels outcome is negative to them, then the person may go into the anxiety. So it is normal in our everyday life. But the persons having anxiety have to overcome the situation and get relief from this. If not, they going to the disorders. So anxiety is not unhealthy. Too much anxiety is unhealthy. In anxiety, the symptoms are shown in 4 areas. What are other somatic symptoms? Hyperventilation, tachycardia, palpitation, swallowing, tinnitus, sound hearing in the air, tinnitus, dizziness, nausea, sweating, trembling, shakiness, urgency to urinate, lump in throat. That's what are all the cognitive symptoms? Specific fear, something negative will be going to be happen. That like belief they have. I will lose control. I'm going to crazy. I'm going to die. That like they feel. What are all the behavioral changes? They avoid the situation. They withdraw something. They escape from the situation or they get aggressive in the situation. What are all the emotional symptoms? The person may have nervousness, having worry, having panic to the situation, having terrified, something is going to be danger, that like terrified, scared, depressed, that symptoms are shown in emotional area. So feeling of unreality, so it is not going to be happen. I will not be take away from the situation. That like unreal feelings are come and I am on the edge. That like feelings are come to the person. Many of the anxiety disorders starts in childhood, but we don't care about that. Then the person in adulthood they face many complications. So then the person having the treatment. So in childhood we have to notice some things. The child having frequent stomach ache or headache in school time. So the child refused to go school. The child refused to participate in activities. The child start escaping from the situations. The child having intense worry or fear in the daily occupation, daily activities, wanting to avoid school, having overwhelming fear, which means go to the outside the person may have breathing problem, that like overwhelming fear. So these signs should be noted in the childhood stage. Then the adulthood stage is protected. Living with anxiety is like a being followed by a voice. It knows all your insecurity and uses them against you. It gets to the point when it is the loudest voice in the room, which is the only one voice you hear in the room. Variety of anxiety disorders are there. We'll discuss some. First, separation anxiety disorder. Separation, the leaving anxiety. So leaving from the parents, leaving from the home. So when the person is separated from anything, anywhere, anyone, so the person having the anxiety. So separated from the parents, the person may having the anxiety. So that is a separation anxiety disorder. Generalized anxiety disorder. In this, the person having lot of worries. Due to this, the person may have lack of sleep, trouble in concentration, getting tired, and having the headaches frequently. These are all happen. Then panic disorder. The person feel very scared, so the person can't even breathe also. If the person feel very scared in one time, then it is a one panic attack. It continues. Frequent panic attack means panic anxiety disorder comes. Selective mutism. The person withdraw the situation and mute their mouth. Some person after this can develop the social phobia. If they are going to be mute their mouth, then they have the social phobia in future also. Then situational anxiety, social anxiety, phobic disorders. Phobic disorder is a fear, some fears. Hydrophobia means fear of water. That disorders substance-induced anxiety, medication-induced anxiety, and other specified anxiety or unspecified anxiety disorders are there. Okay, how to assess this? We have to clarify the symptoms and look at history. Then analyze the current lifestyle. Then rule out the causes, physical causes, psychological causes. Then analyze the medical results. If the person having drugs, so alcohol, that like, then drug usage rollouts should be noted. These anxiety disorder can be curable, so it can be treated. What is a cycle of anxiety? First worry, then belief system. So believe the worry, then over control. We have to control our brain in this worry. It triggers the panic. So it is a cycle. So again panic induces the worry. So this like again panic, worry, cycle. So this is a anxiety cycle. By relaxation techniques, visualization techniques, we can break the cycle. We can use CBT, cognitive behavioral therapy, in which thoughts, our thinking can control our feelings and that control our behavior. So what we think is expressed in our feelings and it shows in our behavior also. So by this therapy, we can first change the thinking of the person. Then we can change their feelings. So anxiety is also the one of the feelings. Then we can use the psychotherapy also to treat the person. Okay guys, I believe this video gives you more information about the anxiety disorders. Be proud to watch our video. Thanks for watching. Bye.